morning, good afternoon, and good evening from wherever you're joining us from. My name is Dr. Gynaecologist. I am an obstetrician gynecologist, really passionate about preventive maternal health and infertility. So today I want to talk about missed miscarriages. A missed miscarriage is a type of miscarriage in which a pregnancy started and then it stopped growing, but it is a silent miscarriage in which there is usually no bleeding, there are no issues that the mother can predict. But when they go to do a scan, they find that the fetal heart rate or the baby's heartbeat is no longer there. So one of the commonest cause of missed miscarriage is actually a chromosomal abnormality, which means that the genes of the mother and the genes of the dad did not connect well in order to get the new baby. Therefore, the baby was incompatible with life, and therefore the pregnancy stops. There are other things that can cause a missed miscarriage, especially recurrent ones. For example, if the mom has a hormonal issue, for example, thyroid disease, or prolactin levels are very high, or they have insulin insufficiency or diabetes, or that their progesterone levels are not responding very well to the pregnancy and therefore are unable to maintain the pregnancy. Whatever the reason may be, we do have tests that we can test after the pregnancy to check on some of these issues and therefore be able to prevent them in future pregnancies. Missed miscarriages happen in about 5% of all pregnancies. Usually there's nothing the mom has done, therefore please do not blame yourself. If this has happened to you in the past, kindly please don't blame yourself. Work with your gynecologist for future pregnancies, and please be there before or immediately you realize that you have a positive pregnancy test. Other than that, if we do find a missed miscarriage, there are things that we can do. It is either treated medically or surgically based on how your gynecologist will guide you. And it doesn't mean that the next pregnancy has to have a miscarriage. Also, it's imperative to know that no matter the type of pregnancy, it is important to be on folic acid from the beginning because folate or methylfolate is very important in gene and DNA formation. I hope this helps someone. If you have someone who's had this before, kindly share so that they may know what to do. If you yourself have been afflicted, know that it wasn't your fault and that there's something we can do to make sure that the same doesn't replay. Also, if you've had a missed miscarriage, please wait at least one cycle. That means one period from that one that had a pregnancy loss, so that you prevent a further recurrence, and you are going to be fertile within 10 days of having the pregnancy come out, whether medically or surgically. So for the first 1 month, please, we advise you to protect yourself from getting pregnant, either using condoms or whatever contraceptive you're going to discuss with your doctor. I hope that helps. And till next time, it's your doctor, Dr. Gynaecologist. Thank you.